Okay, I think we'll kick off with, I know other people will still be joining, sorry for the slight delay. My name's Sian Rudge, I'm the head of the Evidence for Action Division at the Sachs Institute, and I'm facilitating this session today. I'd like to begin by acknowledging the traditional owners of the many lands that we're all meeting on today. I'm on the lands of the Gadigal people of the Eora Nation. Like to pay my respects to elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander people joining today. You can use the chat function if you'd like. It would be great to hear where you're from. If you'd like to introduce yourself and let us know what lands you're on, that would be great. So just very briefly about the Sachs Forum. The Sachs Forum was launched in 2020 to help the Sachs Institute and its member organisations, so the researchers, universities and research institutes, to better connect, to share expertise and to further develop collaborative opportunities. And out of that work, a number of things emerged that were important to members. And one of those areas was this topic that we're discussing today on working collaboratively in Aboriginal health research. Thanks, Hannah, for the next slide. So this is the second of our workshops on Aboriginal health research. The first was held back in May, and that had a focus on the key principles to consider in Aboriginal health research, including the importance of that research being Indigenous-led. If you want to have a look at that recording, either if you missed it or if you'd like a refresher, you can have a look at that on our website, and we can put the link to that in our chat function here if that would be useful. So the workshop today builds on that. What do you need to know and do when you're conducting research that is with or might affect Aboriginal people and communities to ensure that the research is culturally appropriate, meaningful and is ethical? I'd like to acknowledge the substantial contribution of others at the Sachs Institute, including our Aboriginal health team here in shaping these workshops, including Sandra Bailey, who will be known to many of you. Sandra is our Senior Advisor in Aboriginal health. And thanks to all who are joining today. We really appreciate everybody making the time to join. We have people from the Sachs member organisations. We have staff from New South Wales Health who are working in Aboriginal health research, and we have staff from AMSs. So welcome all. We're really keen to get your input into the session, and I'll talk about how to do that. So thanks, Hannah, for the next slide. So just as an overview of the program, we're really very excited and very pleased to have speakers with really outstanding expertise and experience in these areas. And I'll introduce them all a little bit before their talks, but we'll be covering off on strengths-based approaches, cultural safety, ethical research principles and Indigenous methodologies. Thanks, Hannah, for the next slide. So just some housekeeping. You'll note that you have your video turned off and your microphone muted. So if you can use the chat function to make any comments, to ask any questions, it would be great to get your input into the session. As I mentioned, there'll be time for discussion, either directly after the speakers' presentation if it's directly relevant to them, or we can hold over questions until the end. We do have good chance for discussion with the panelists at the end of the talks. And just to note also that the workshop is being recorded, and we'll make that available on our website to have a look at later. So I have the great privilege of introducing our first speaker, who is Kathy Clapham. So Professor Kathleen Clapham is a descendant of the Morawari people of northwestern New South Wales. Kathy is a Professor of Indigenous Health at the University of Wollongong and the director of its Ngunnawal Ngaju First Peoples Health and Wellbeing Research Centre. So she's also an honorary professorial fellow at the George Institute for Global Health. Kathleen brings many decades of experience in Indigenous health, higher education and research. And Kathleen is going to be talking about strengths-based approaches in Aboriginal health research. So over to you. Thanks, Kathy.
Thank you very much. It's my pleasure to present today on strengths-based approaches. I'm coming from Darawal, Wadi and Yuin lands, and I will just first share my my screen. I'll commence by acknowledging that wherever we are, we meet on the lands of Aboriginal Torres Strait Islander people, and I acknowledge the traditional lands and waterways in which we gather on today. I acknowledge elders past and present and all Aboriginal Torres Strait Islander people present today. So strengths-based approaches. In the times that we live in, it could be more important to acknowledge the persistence of the colonialist narrative and the power of resistance. As tensions around race and identity have risen to the surface in recent years, the challenges that Indigenous communities face globally are clearly evident. The tense clashes around the perpetuation of the representation and celebration of colonial history in recent years is a stark reminder of the differences in worldviews between Indigenous and non-Indigenous peoples, and the perpetuation of the powerful colonialist narrative that was so evident, for example, in the defence of the Cook monuments over recent years. This difference also persists through the research domain, and it shapes accepted research methodologies. And while media and attention and political tension is frequently on policing, violence and incarceration, research is clearly part of that history, and it is still undergoing the process of decolonisation. Research in Indigenous communities is frequently undertaken by outsiders who are ignorant of the profound knowledge embedded within Indigenous communities and indifferent to local community culture. The continuance of a deficit mindset contributes to the history of failed solutions to Aboriginal problems. But in recent years, we've seen a substantial body of work across a number of disciplines, including increasing number of Indigenous higher degrees research studies that share shine a critical light on the impact of that deficit mindset on the Aboriginal communities, which they purport to improve. So through the use of Indigenous methodologies, these scholars are disrupting the narrative and subverting that discourse. So what does a deficit view of Indigenous health look like within Indigenous health research? Well, it's manifest in many ways. One way is a top-down approach to solving problems. The quick search for quick or actionable answers to complex issues that really need time and resources to resolve without understanding the layers of content that need to be considered is typical of this view. In a practical sense, researchers often fail to acknowledge their position of privilege and inherent power imbalances and economic imbalances in research community relationships, particularly in regard to the expectations that are made of community members and organisations, for example, to be willing participants to consent and support research with no clear outcomes. We can no longer fail to recognise white privilege and the inherent power imbalance in that relationship. There are also issues around lack of Indigenous voice in data governance and in high-level decision-making. And partly this is due to the limitations of the Indigenous health workforce. There are still few Indigenous researchers, particularly senior researchers, and too few Indigenous people on boards and decision-making positions and structures. Deficit thinking is also evident in a lack of or tokenism in Indigenous leadership. We see a failure to acknowledge and value and reward the work of all of those involved in Indigenous research, Aboriginal research assistants, those who support research. For example, practices such as putting Aboriginal people on grants and failing to involve those people throughout the research process. So thinking that inclusion means that having one Aboriginal community representative on a committee and not thinking about the isolation that creates, the burden of being the lone Aboriginal voice, or the assumption that one person is able to represent all of community or all of diverse communities. Deficit also looks like collecting numerical data on Indigenous status or data linkage with no clear purpose. Clear purpose or research questions or Indigenous input into the interpretation or use of that data, or the implications of publications that may stigmatise or shine a negative light on particular communities or sectors of communities. Deficits also evident in the public health narrative. Over the past decade, Indigenous research has been dominated by a focus on negative statistics and research on the social determinants of health, which have indeed highlighted the glaring inequalities between Indigenous and non-Indigenous peoples in health. But focus on measuring health inequality through closing the gap has also drawn attention away from the strengths and resilience of Aboriginal people and communities. So Aboriginality is commonly presented as a risk factor, a poor predictor of health and premature death. Aboriginality has become equated with vulnerability, disease and premature death, dysfunction and non-compliance. And as part of this, there has been inadequate cultural safety training of health, education and social work practitioners to actually address this problem. And the way that research knowledge gets translated across into policy and particularly into practice is that health practitioners respond to these problem-centred approaches in a way that encourages fixing the Aboriginal problem. There's still grossly inadequate training in cultural safety, as I said. So we're confronted with the legacy of literature with this negative discourse. And if we look at particular areas in the literature, this is evident. For example, Gay's work on the lack of the strengths-based approaches to child health portrays Aboriginal parenting in a negative light. The literature on poor school attendance fails to contextualise negative outcomes, reinforcing deficit mode in child services rather than looking at the way the school system fails children. The public health and nutrition literature may be characterised by deficit, disease and dysfunction, according to Foley and Schubert. Aboriginality, therefore, has been defined by others and is firmly located within a negative world of meaning. And this, as the literature, as I said, the literature that's accumulated over time, it's evident also in the methods that focus on gaps and weaknesses. For example, needs assessments that continue to confirm the same problems with few solutions. Behavioural change approaches that focus on individual level change can have a moralistic tone leading to victim blaming and failure to identify structural causes and context. So this a narrow view and definition of culture to explain unhealthy behaviours tends to rely on stereotypes. And the single risk factor message overlooks the complexity of upstream influences. This quote from Bond in 2005 says, why does Indigenous health discursively reverberate around the inadequacies, impairment and hopelessness of our people, families and communities? What is left for us that we can draw from to make some improvements for our lot in life? I find it hard to just passively accept, as both an Indigenous person and as a health professional, that Indigenous communities have nothing to bring to the table in efforts to improve our own health. And although this quote is from a 2005 publication, and some things have changed, many things have remained the same, and we need to continue to understand, educate and change practice practice and views to take into account these critiques by Indigenous scholars. So we've had over recent decades an emerging Indigenous paradigm with leading Indigenous scholars such as Wilson, Vasara, Martin, Smith, Kovac, Walter, Morton, Robinson, to name a few, that demonstrate the efficacy of Indigenous research methodologies when conducting research into Indigenous issues, and where findings of the research underpin decision-making which impacts on Aboriginal futures. Karen Martin, for example, notably has been very influential in Australian literature, identifying 4 principles that underlie the practice of research using Indigenous methodologies, recognising the Aboriginal worldviews, knowledge and realities as distinctive and vital to Aboriginal existence and survival, which serves as a research framework, honouring Aboriginal social mores as essential processes through which Aboriginal people live, learn and situate themselves on their own lands and in the lands of other Aboriginal people, emphasising the social, linguistic, cultural, historical and political contexts which shape Aboriginal experience, lives, positions and futures, and privileging the voices, experiences and lives of Aboriginal people and Aboriginal lands. So what is a strengths-based approach to counter these and operationalise these principles? Based in community development, strengths-based approaches have been around for a long time. Based in community development, they draw on the concept of social capital, which has a long history but was popularised in the 1990s, for example, in studies by Putnam. And this idea is based on the idea that individuals and groups derive benefits both from tangible and intangible resources, such as interpersonal relationships, social networks, shared information and understanding. It also recognises that social inequality can be reproduced through differing access to social capital. For example, Bordeaux's work, which saw power as culturally and symbolically created and constantly legitimised through an interplay of agency and structure. The main way this happens in Bordeaux's work is through what he calls habitus, or social norms or tendencies that guide behaviour and thinking. So in the context of Indigenous research, what can an Indigenous strengths-based approach be? Well, it can be many things. Applying these ideas, it can be a genuine Aboriginal-led research agenda that challenges the negative stereotypes and supports a broader appreciation of the richness and cultural diversity of Aboriginal culture and history. This harnesses the energy and ingenuity of Indigenous communities and recognises and celebrates that ingenuity. And as with Martin's work, it privileges Aboriginal ways of knowing, being and doing. It also adheres to Aboriginal and Torres Strait Islander ethical principles, including the accountability to community, reciprocity and cultural safety. It can shift the focus from problem to inherent strengths of families and communities, such as in the work of Gaia. It strives for equal partnerships. It addresses inequities through empowerment. And Aboriginal community members can be provided with resources to participate meaningfully in research, for example, through collecting and documenting their own stories. And it uses language that is inclusive and non-judgmental. So what does that involve for researchers? Again, there are many things that can be adopted, shifting the focus away from deficit towards community strengths, capabilities, resourcefulness, potential, looking at and considering community culture and the profound knowledge embedded within communities, taking a backward stance and somewhat of a stance of humility in relation to Aboriginal communities rather than a stance of privilege, honouring Indigenous stories and oral history. The active engagement of end users in all stages of the research process is important here, including the initial research focus, the initial questions, the methods, and also the dissemination and skills transfer for community capacity building so that communities can better engage in the research process. So this strengths-based approaches aligns with Indigenous research methodologies, with social justice approach, with empowerment approaches, with community-based participatory research, and with qualitative and quantitative methods. It involves genuine partnerships. Research by Aboriginal researchers demonstrates that cultural determinants are particularly important here. Cultural connections, identity, self-esteem, and resilience. There are also some challenges for taking an Indigenous strengths-based approach in research. One of those challenges is the culture of entitlement within universities and research institutes, which contributes to that barrier and those power inequities. The lack of institutional support for multidisciplinary community-based research is also a barrier, because very many perspectives can be taken on, utilised within a strengths-based framework, and should be. Deficit perspectives tend to dominate the peer-reviewed literature. So, as I said, we have a legacy of this sort of literature, which is read and adopted. There can be difficulties in publishing small community-led initiatives and studies. So it can be more of a challenge in terms of career for pathways for researchers. There are also challenges in the fact of the research capacity of the Aboriginal research workforce is small, and there is a great need for networks and for leadership and development. And there's also, being truthful about equality in partnerships is a process that takes time, and it means continuing to meaningfully engage with communities and taking long-term approach to research relationships. There are practical challenges, time building and maintaining those relationships and investing in those relationships, long-term investment in those community research collaborations. As I've said, the community, building that community capacity to engage in research and becoming real equal partners, equally invested and with rewards in that process. And also working effectively within the expectation of researcher, community and policymakers can be challenging in particular contexts. So moving towards a strengths-based approach can involve challenging the dominant deficit discourse when it appears, really acknowledging where the benefit of research lies and ensuring that there is a distribution of that benefit to communities. Strengthening community connections by bringing Aboriginal community stakeholders into that process, planning, implementation, data collection, analysis, writing and dissemination where it works for them. Building capacity, building an Aboriginal-led research agenda, and acknowledging the importance of knowledge translation to ensure that research effects change. Sorry, I've got a typo. That facilitates research into policy and practice. Another way of adopting a strengths-based approach is using creative approaches to knowledge transfer, and there's an emerging but interesting literature on this topic. This quote from the authors Cooper and Drager say that we developed a series of key considerations applied to the dissemination that we applied to the creation of dissemination products from qualitative interviews and focus group discussions from two Manitoba, Canada's specific public health research projects with Indigenous communities, and created products such as activity sheets and board games and non-fiction story books. So looking at more creative ways of working with community and disseminating and transferring knowledge is another way which can be explored. Some other strategies and approaches is adopting research methods, Indigenous research methods such as yarning, community audits that focus on individual and group capacities, resources and networks, art-based and creative methods, recognising, articulating and celebrating Aboriginal knowledge, acknowledging the role of elders, leaders and young people, And then there is the important issue of implementing data sovereignty that involves Indigenous oversight into data governance at the highest level, providing knowledge that is and data that is needed at the local level and contextualising negative statistics. And this is part of a much larger discussion. Then there are other strategies such as participation in local events, developing community-based research agendas in emerging priority areas that are priorities for community. And that includes incarceration, juvenile justice, the important area of child protection, environmental justice. These topic areas that are still under-researched in the ways that are valuable to communities. And I've just provided some examples there of some research around driver licensing, research around positive focus research with kids and youth that I've been involved in, the driving change study, which is around driver licensing, the search study, the longitudinal study of Indigenous children, Safe Career Kids study, which was about improving safety of kids. Other strategies include reciprocity and financial support, undertaking research and evaluation projects that are valuable to community, using the privilege and economic power of universities and research institutes to support in a really practical way organisations with professional IT strategic support, providing organisations with access, community organisations with access to online publications, for example, and resources, and engaging in a participatory writing process. So there are many strategies that can be utilised by researchers to really operationalise these strengths-based approaches. And I've provided a couple of examples of here, which is just about reframing the public narrative from that deficit to a strength-based discourse. And we're seeing it in the reframing of statistics. And this has become evident even in recent Closing the Gap reports, in research reports, reframing the way the positive aspects rather than focusing on the negative, on the inequities, but looking at where the strengths and where the positive factors are. But we still have a long way to go in embedding this approach within the work that we do. And I've gone through pretty quickly to provide some examples and some strategies that can be utilised. But in summing up, the focus on strengths-based approaches draws attention to the fact that the deficit discourse has portrayed Aboriginal people as a problem. But Aboriginal people are not a problem to be solved. The deficit discourse has surrounded Aboriginal populations and this has had detrimental effects on Aboriginal men, women and children, real-life consequences, denying Aboriginal agency, reinforcing negative stereotypes and masking the strengths, capabilities and values. The social determinants of health approach and the Closing the Gap work that's happened over the last decade has identified inequities, but it has become very overly technocratic and deterministic, lacking a nuanced approach to explain the multi-layered complexities of people's lives. The key relevant concepts related to health and culture from an Aboriginal and Torres Strait Islander worldview need to be understood in the way that they are being understood within Indigenous research methodologies frameworks. And that includes looking at the cultural determinants of health, such as strong connection to culture, strong identity, self-esteem, resilience, which all play an important part in good health. So Indigenous communities have many strengths, leaderships, ways of knowing, being and doing that need to be recognised and respected in this in a strengths-based approach. Thank you.
Thanks, Kathy. That was amazing and really very comprehensive. And I note in the comments that Kelly has said she can't take enough notes, and will the presentations be made available? So yes, that we will have a link to those up on the website by the end of the week. I would just ask people to put any comments in the chat function. We will get back to those at the end of the session or during the session as needed. But look, thanks, Kathy, again, that really important sort of shift in thinking from looking at deficits to framing the discussion around strengths is so important. And you gave some really good practical examples about the way that you would do that, or the many ways that drawing on strengths that are inherent is a really fundamentally important way to conduct research with Aboriginal people. So thank you. That was really amazing. And I'm just going to move from one amazing presentation to another. So I'd like to introduce to you Karen Beatson. And so Karen Beatson is a Mandindangi woman and has lived and worked in the Dharawal community for most of her life. She is the Deputy Director of Aboriginal Health at South Western Sydney Local Health District and was previously the Manager of Family and Community Programs at Dharawal Aboriginal Corporation. Karen also has over 30 years of experience working in Aboriginal community development across a number of sectors, including employment, education, juvenile justice and health. And today, Karen's going to talk to us about cultural safety in Aboriginal health research. So thanks, Karen, over to you.
Sorry, Sian, I think I started sharing before and was covering you. Good morning, everyone. I'm just going to try and share this. Just tell me if this comes up, what you're seeing. I'm not seeing it. What I might do is, if it's okay. Are you seeing my screen?
We had it. Got it there, but not on the slideshow setting. But there, it's on slideshow. If it's We Care Transforming Your Experience, now we can see the whole slideshow, the whole slide. Yeah.
Okay. Thanks, everyone. And my presentation today, I'd like to talk about my experience from South West Sydney Local Health District and as an Aboriginal person within the research arena, and how I came to be part of it and what I saw needs to have cultural safety within and what aspects are. So it's about collaborating with our Aboriginal communities to ensure cultural safety within research. So I too would like to, I'm a Mandindangi woman, originally from southwest Queensland, but I was born on Gadigal land and I have family ties to Namba country and my extended connections to Dunghutti on the on the north coast of New South Wales and Wadi peoples of the south coast. I'd like to pay my respects to the Dharawal peoples, elders past, present and emerging, whose lands I'm coming to you from today. I also live on those lands and I acknowledge the resilience, guidance and wisdom of all my elders, knowledge holders, and utilise their teachings to inform and inspire my practice. So I've lived and worked across the lands of the Dharug, Gundungurra and Dharawal lands for the past 45 years and have many community and cultural ties to various communities across New South Wales and Queensland. So I've worked in the Commonwealth employment and education, New South Wales juvenile justice, Aboriginal community controlled health services and New South Wales health. And during those times, I definitely have seen a lot of research and been presented with a lot of research on Aboriginal people that at times I've maybe questioned the data captured or how it's been presented to me. So if we look at what culture is and cultural safety, so if we see culture as really being an umbrella term, which is encompassing the social behaviour, institutions, norms found in human societies, it's virtually everything. It's the way we're raised, our values, beliefs, our whole systems. So culture is virtually everything. And it's how we absorb that culture that is really important. And I think is really important when we're conducting research with Aboriginal people, how that plays out. So if we look at, you know, when do we receive, or when have we, reached cultural safety? And if we look at it from within working in the health arena, it's when a recipient of care deems the care to be meeting their cultural needs. When people feel safe and secure in the health environment, due to the shared respect of meaning, knowledge, and experience, when we're ensuring dignity and true listening has been achieved. Cultural safety incorporates cultural sensitivity, which refers to sensitivity of cultural factors and taking them into account. So, and Kathleen has highlighted a lot of this in her presentation, but I wanted to do this from my perspective. When I was first, research and growing up, what I thought about research from an Aboriginal person's perspective, and what we saw portrayed to us. So, and when it was reframed to me, and when I started learning about different things about my culture and seeing it from a strengths perspective and not the way it was portrayed through education or the media about my people, I started realizing that our whole community needs to know this. So Aboriginal Australians, we're known as the longest living continuing culture in the world. So we have been gathering data, analysing, recording and sharing the results of our research since time began, yet we did not call it data. We didn't call it research. And we've done this through our story, through song, dance, painting, our songlines and our dreaming. So when we are able to reframe and see it from a different perspective, it definitely changes the story in my head and definitely the people that I work with. So when we look at the impacts of colonisation on, and our knowledge was dismissed. The whole doctrine of discovery already dismissed our spiritual beliefs. Early colonists recorded our beliefs, our agricultural practices, our language, the way we lived through their cultural lens. It was often misinterpreted and misunderstood. When people did take the time to listen and understand, there have been many conflicting records, about it's only now how people are now analysing the records and changing the history. And we can see this in definitely around our agricultural practices and how they were initially recorded. So Aboriginal Australians are one of the most analysed and recorded peoples in the world. And this gathering of data was taken without our knowledge, permission, and interpreted and used against us to dislocate us from land, families, and communities. So the Aborigines Protection Policy came about from the gathering of this data. And when we think about if someone was to come into our community and talk about that they wanted to do research, when you look at it, that perspective from our cultural lens, it has a very negative context. So whenever we are going into our communities, We need to come from that strengths perspective. We need to acknowledge the history of Aboriginal people in research, both positive and negative. So, and, you know, Kathleen already just spoke about the deficit perspective of research and how that has had. So I think if I can use it as a practical example, if you were to come into, you know, if we were looking at creating cultural safety within research, any research being done within our local health district, you have to understand us. You have to know our history. So our health district sits across the lands of the Dharug, Gundungurra and Dharawal lands. These nations were one of the first nations, you know, one of the first nations who were impacted by colonizations. So we have had a negative impact of the data collected on us, the stories that were told and what was captured. We have 3 key Aboriginal organisations that we work with within health. Aboriginal Medical Service, which is the second longest Aboriginal medical service in the country. We have Gundungurra Local Aboriginal Land Council, which has a health service attached to there. And we have Kari Aboriginal out-of-home care organisation, which is the largest in the country. But we also have the largest, you know, we service 6 hospitals within that arena, and we have the University of Western Sydney that forms part of that, our community. So we are often asked to participate in and to help when people are asking and approach us to do research, to introduce us into the Aboriginal community. So one of the things that we play a role in as the Aboriginal Health Unit is we oversee a range of culturally specific programs and services. We support the workforce attached to the programs, and we manage the partnerships and collaboration with Aboriginal community organisations. So our community, having one of the, you know, oldest AMSs in the country, has a long history of political advocacy of Aboriginal people and equity. So wanting equitable health services. We also had an Aboriginal legal service at one time, and at different stages throughout the history of our community, we've had varying functions. The way that governments have set up funding arrangements have actually had our organisations competing against each other, and health has definitely been contributing to that arena. So one of the things that we had to do, if we were going to establish cultural safety, not only within an organisation, with any future research or gathering of data, we needed to have a partnership with our Aboriginal community. So we have a partnership with each of those organisations where they set the agenda, where it's not health's agenda. You know, we all have the same agenda around closing the gap, yet it's what our Aboriginal organisations choose and identify as the need that we have had to do. When we talk about creating cultural safety, we have to openly listen and actively, you know, respond. So we also work with our mainstream services in our organisations to improve the cultural responsiveness. So when someone said to me, what is cultural safety? I was thinking, well, if you actually work and follow, you know, AH&MRC's 5 key principles, you will achieve cultural safety within your you know, research. But then I realised a lot of people don't really understand what it actually means to achieve these principles. So I might give you some examples around some of my experiences and how we've definitely changed our practices within health, and whenever we agree to help facilitate research projects or engage our Aboriginal community into supporting those research projects. I was first working at Tharawal Aboriginal Medical Service when I was shown some research that had been just completed on our Aboriginal child and family programs, and which was informing the local health district about how they were going to set up their new child and family programs. The data that was being presented was capturing, and there was a lot of stuff around the speech of our children. And when I looked at that research, the data and the analysis and interpretation of that by the researchers, I realized that that wasn't what I was seeing. I was actually seeing something different from that data because I had a different knowledge that they had about living and growing up in Aboriginal family, but also being an Aboriginal parent myself, understanding the cultural and the psychosocial impacts that affect our parenting. So I also realised that that research had you know, an Aboriginal person attached to that, and you know, they at only one time. So there was one lone Aboriginal voice. And when I've seen the work that we've done within our health district, I was seeing very similar things happening, where we would put one our Aboriginal people and or two workers within large organisations, where over time their voices would be drowned out. And we were adopting westernized thinking and, you know, thoughts. So it was when we started having the discussions as an Aboriginal person, what this would actually mean is when, you know, things started changing. And it was about how could we have Aboriginal voices in research when, as an Aboriginal person, we had this negative exposure to research. We often would feel intimidated and not comfortable speaking with academics who this was their bread and butter. This was the language that they used. So it was about breaking down those languages. One of the things that we've often seen from researchers coming into our arena is about they already have a proposed, you know, question that they want to capture. And when they're asking us to go to our Aboriginal medical service to get their support and endorsement, sometimes that is being challenged by their board to say, we don't want to know about that. We want to know about this topic. This is what we are finding we need evidence around. We need, you know, support with this. And being able to have those researchers sit and discuss and hear the perspectives and maybe change their research question. Also, how the methodology is chosen, listening to the Aboriginal people that you're working with, what would be the best ways of doing that. Understanding that if you're going to work in these communities, you really have to understand the history, but also the local connections and who are the right people that you talk to. So understanding Aboriginal governance structures within local communities is really important. This is an example of our Aboriginal governance structure within Southwest Sydney Local Health District. It's very detailed and in-depth, where we have Aboriginal voices at all stages, from consumer, you know, if we looked at where we have Aboriginal staff, we've set up you know, where they can have Aboriginal voices at each stage. And the reason why I show you this is because often I live and work in my local community, but when people see that I'm on a reference group, they will actually say, and just look at my title, you know, when we're doing, you know, the ethics, that, well, she's an Aboriginal government worker. Where are our community? I think one of the things that researchers have to realise is that our community is often approached and asked constantly, especially as people are becoming more aware that we need to have Aboriginal voices, that the same people are constantly being asked to put in their time to consult. And often that is done without remuneration of their knowledge or their expertise or their time. So we are often the Aboriginal Health Unit within Southwest Sydney LHD, and we recognise that not all LHDs have, with their Aboriginal community, have the same relationship. So it's really important that when you reach out to Aboriginal organisations or people, to realise that they have many competing priorities. Their timelines and their priorities aren't the same as maybe yours. So it's often good to have an advocate or someone who can help introduce you into that community to create this. So in not all LHDs would the Aboriginal Health Unit be that people to go to. It may be a different community person, but you would have to reach out and connect. And recently there was some evaluation or studies done within our community where we had some, you know, sorry business happening, and that affected one of our organisations. It might mean as a researcher that you would need to revisit that timeline or that space and come back at a different time. What we had those researchers that are evaluators just excluded that organisation from the conversation because it didn't meet their time frame. To me, that is not, you know, having cultural safety or working in a culturally responsive way when you have to do that. So I just wanted to show that slide just to show that it's when you talk about cultural safety, it has to happen over a certain period of time. You cannot achieve this immediately, and it's a process. So I just, sorry, missed my slide here. So when we talk about and how we're achieving cultural safety, especially within the research arena, we operate that as an organisation, as an Aboriginal Health Unit, and how we're trying to make these changes across the whole of our system. So we have an appreciation of the impacts of colonisation and transgenerational trauma. And whenever we're going to do any type of work with our community, we always acknowledge the impacts of transgenerational trauma. So cultural safety is always at the centre of all of our models of care and the way that we work. We appreciate the diversity of Aboriginal cultures. So within Southwest Sydney, we have over 40 different Aboriginal nations. We are a relocation site. We have large public housing estates where Aboriginal people have been, you know, originally moved off their lands onto missions and reserves, and then have then chosen to move due to the large you know, how housing was offered to our people over time. So we also recognise that although they're living on Dharawal land, where there is a very sad history of the peoples that have been colonised here. They also have, the Aboriginal peoples living here also have connections to their countries of origin. So there's also differing cultural practices, languages and beliefs. And so when we're asking, you know, people to participate, we have to be mindful of that diversity and to cater. So what might work for one group of people might not work for another, and how we acknowledge that within, if we're doing yarning circles or the way that we're working. So we always work holistically. So if we were running a yarning circle or someone to gather information and, you know, especially in research, and we're targeting a certain age group, if they needed to bring other people into that space, that would be allowed. So that's one of the things, you know, if elders are minding, you know, grandparents are minding grandchildren and they need to do that, we need to look at that and cater for that. So we've, you know, looked at developing culturally responsive service models, how they meet the needs of our community. We now embed cultural frameworks within our clinical models of care. So by doing this, not only with us and our staff across the health district, those staff will at times are researchers. They're evaluating programs, they're conducting this. So if this is their way of working and absorbing our knowledge in that, we will eventually achieve cultural safety without having to think, okay, have we met this? It will be a way of working. So we always come from a strengths-based approach, and something that happened recently within our, we were doing, there was some research around diabetes happening within one of our hospitals, and they were wanting, you know, just to take bloods from people coming into emergency. And we said, you have to, you know, ask Aboriginal people. You can't just take this. This has been the history. So we've had to explain the history to our doctors. And then they felt, we'll just do an opt-out. You know, people can opt out. And we said, well, how will they know what you're doing? So they designed a poster, and the poster, or, you know, a leaflet to give people to say. And they were wondering why people were not wanting to be part of the research and study, because the leaflet, and I said, you know, can we see what the leaflet, what you were doing? And it actually said, did you know that diabetes kills? And I said, of course our people aren't going to do that, because if you said and reframed it that, did you know that diabetes is preventable and that your work can actually change and help your family, they then got a lot of people opting into the study and agreeing to collect their data. So I just wanted to show that in my last then slide. So what we do when researchers come, so we will assist with the facilitation and connection to community. We will advise. We will, you know, help engage with the local Aboriginal organisations, depending on what your study, and help with getting support letters for your research if that's something that the organisation agrees. We will consult on the design of the research study. We'll help with the cultural communication, and what we've done recently is integrate some cultural healing practice into yarning circles. So we will set the cultural tone of that yarning circle so it does come from a strength focus. It does acknowledge Aboriginal people's pre-existing knowledge to research, and we will ensure that analysis and feedback of the outcomes and results are culturally responsive, but have had Aboriginal people across our community connected. So it's a little bit different how we work across. And this is just some ways about how we've provided ongoing training to develop and implement cultural competency within our organisation. So that's something that if you're going to start doing research within, Aboriginal communities, think about how you already work within your organisation and practice about the cultural competency of your staff and organisations. So I'll just end there, Sian, so I can see you've joined back. Thanks, and I'll finish sharing.
That's great. And again, really lots of really very useful things to help understand what cultural safety is. And you've emphasised a few times that the sort of it just doesn't happen overnight. There's lots of work that goes into building cultural safety. I thought one of the really interesting things was about how that happens and as Kate White has mentioned, online across multiple levels. It's not just, one researcher working with one organisation. You're talking about an organisational and a system approach to really embedding cultural safety. And I've written down, you've noted that it becomes a way of working, but that way of working takes a long time with a lot of input. So thanks again. And just a reminder to everybody joining, please feel free to put any comments or questions into the chat function, and we'll get to those. And I'm just going to move on and introduce Michael. So sorry, I'm just so Michael Doyle is a Bardi man and chairperson of the Human Research Ethics Committee at the Aboriginal Health and Medical Research Council of New South Wales. He's also a senior research fellow at Sydney Uni, and he's worked towards the improvement of Aboriginal health throughout his career, which began as an Aboriginal health worker in his home community of Jarrington in Western Australia. But before inviting Michael to talk about ethical research principles, I'd like to acknowledge and to congratulate Michael and the AH&MRC Human Research Ethics Committee on receiving a 2022 Reconciliation Australia Indigenous Governance Award. So this is really a fantastic achievement, and it rightfully recognises the critical role that the committee plays in ensuring high quality and culturally safe Aboriginal health research that makes a difference for Aboriginal people. So congratulations, and I am going to pass over to Michael. Thank you.
Thank you. I feel a little bit, I don't know, I'm blushing now. Thank you. What do I say? Yes, you didn't mention you were going to talk about the governance award, didn't you? Anyway, we'll move on to presentation. So thank you, Sian, for the introduction. I'm just going to share my screen. Can you see that now?
Yep, but it's not on the full slide show. Yep, that's now we've got the sort of split screen.
You know what? I did a full presentation, a full lecture in presenter view, and none of the students were just too polite.
They were too polite.
Were too polite to tell me that it was in presenter view. Is that any better?
We still have the presenter view, yep. So we've got the.
I'll rearrange
that. Michael, it's Amanda here. If you go back to that screen, and then on the top of your screen, you should see an option to say display.
You've done it now. Whatever it is you've done, that's it now.
It's got it now? Okay,
yeah.
Excellent. So thank you. Always a few technical issues. So thank you to the last couple of presenters. I would like to begin by acknowledging the traditional owners of the land upon which we meet today, or you're all zooming in from, or Microsoft teaming in from around the whole country, I think, actually, and the traditional owners of all the lands you're zooming in from. So I'm here in Redfern, so I acknowledge the Gadigal people of the Eora Nation and pay my respects to elders past, present and emerging, and to all Aboriginal and Torres Strait Islander people that are on the meeting today. So I'm the co-chair of the Aboriginal Health Medical Research Council Ethics Committee. I feel like I'm going to kind of do some of the boring stuff now and talk about processes and rules, but if you can bear with me, that would be great. So this is the committee, or most of the committee. There's, I think, one person who's missing from that who's just joined the committee. But so Dr. Summer May Finlay, who's an outstanding early career researcher at Wollongong University, is the co-chair, and we do that because we have a gender balance as always in these things as Aboriginal people. Previously, Arnie Valkeed had been the chair for 16 years, and Uncle Danny Kelly had been the deputy chair for most of that time. We have sort of a lot of different people in research roles. We've got people in sort of like as medical GPs, lawyers, and those other positions that a Human Research Ethics Committee needs to fill. We also have an amazing secretariat staff, and you can see Kelly Jones, who's our ethics manager, down the bottom there. So the committee, so the HREC is independent from the AH&MRC organisation. This is a requirement of the National Health and Medical Research Council, under which the committee is registered. Members are appointed by the AH&MRC board. The secretariat staff report through the AH&MRC. They're not like my staff that I can kind of tell them what to do or anything. They are AH&MRC employees. So all applications and associated documents are confidential, and only the secretariat staff and the Director of Ethics and Policy, which is, that position's not currently filled at AH&MRC, but that's the position that the secretariat staff, our Manager of Ethics, reports to. Only the co-chairs can speak on behalf of the HREC unless otherwise nominated. We get a lot of well-meaning people who kind of speak about what it is that the AH&MRC or those sorts of things. That's fine, but just being clear that it's only from the AH&MRC if it's coming from myself or Summer or somebody that's been nominated to speak on behalf of the committee. The only AH&MRC staff that can represent or speak on behalf of the HREC is the Chief Executive Officer, of course, and sometimes we, as the chairs of the committee, will ask Robert Skeen, our CEO, to take particular issues to New South Wales Health that we think should be discussed with them or other organisations. There's also other senior staff within the AH&MRC and our Manager of Ethics as well. So the role and history, well, originally we used to have a thing called the New South Wales Aboriginal Health and Resource Council, which is later known as the Aboriginal Health and Medical Research Council. And under the Aboriginal Health Medical Research Council was where the Ethics Committee was established, and that we began almost a bit over 25 years ago in 1996. We have jurisdiction over the whole of New South Wales, and we're funded by the New South Wales Ministry of Health. The HREC approves or reviews, research to ensure that it's meaningful, ethical and culturally appropriate. So we like to look at, it's got to be something that improves the health of Aboriginal people, even if not directly, is the general gist of why you would be doing research in Aboriginal health, and to help ensure the benefits outweigh harms and risks. And that's really the essence of what ethics is that is balancing that the benefits of the potential research, whatever that research is trying to maximise those benefits and minimise the risks, and that those benefits of conducting the research are greater than any potential risks. Responsibility, the HREC reviews all new research applications every 6 weeks. you don't have to wait 6 weeks to put in an amendment. We review those as an ongoing thing, and annual reports come in, you know, as people lodge them. Publications, presentations, and abstracts, and develops. We also work on developing guidelines with the Secretariat for researchers in New South Wales, and we review and comment on national ethics statements and guidelines. The national framework from AH&MRC is being further consultation on that a bit later this year, and we're going to be involved in that, just to give you an example. Criteria for submission. So it meets the definition of health as per NACCHO. So this is a little bit broader than what the other health focused committees are. And so the definition of Aboriginal health, as you can read there, is a bit broader as we go by NACCHO. And so we look at the sort of social and emotional well-being of the individual and the whole community. And in practical terms, what that might mean for us is that we will look at a project that is perhaps more child welfare, where health-specific committees, or we are a health-specific committee, but other committees have a very more narrow definition of health and what kind of applications they will consider. We are consistent with that broader worldview of Aboriginal health. So the research would be submitted if it's looking at the experiences of Aboriginal people is a sort of specific focus or part of the research. If data collection is being directed at Aboriginal peoples as a group are to be examined in the results. So if you're doing an analysis, and some of that analysis is looking by Aboriginality, sort of doing bivariant or multivariant analysis to see if there's a particular variable that had showed greater likelihood of Aboriginal people being sort of more likely to have a particular health condition, that would be coming to us. If the research will have an impact on one or more Aboriginal communities, and if Aboriginal health funds are the source of the funding for that particular project. Additional criteria, the committee advises on applications. That should, sorry, I'm just reading that as we go along. I'm actually, just so you know, while you can see the whole screen, I'm having to look at the camera, and directly under the camera, I've only got the presenter screen, so I can't really see my slides that well unless I look the other way. Anyway, so we look at the criteria is that the Aboriginal experiences of a particular medical condition being studied is unknown or is likely to be different from that of the overall population. So if you're looking at something that you don't, that there's not much known about it, and you're looking at Aboriginal people, you need to put that to the AH&MRC as well. And there are Aboriginal people services being used in a distinctive way for the study, and that there are distinctive barriers that that limit access to services. The final bit there is about Aboriginal people are known or likely to be a significant overrepresentation in the population group. So a good example within that is that all of the research that's conducted within a prison context should actually come to the AH&MRC, because within the prison system, Aboriginal people make up about 25 or 30% of the total prison population. So the key principles, Karen spoke about these just a moment ago. So these are the 5 key principles that are specific to our committee. I'll go through each of those in a little bit more detail. So net benefits for Aboriginal people and communities. So the benefit there's got to be benefit of it in a general or specific way for Aboriginal people or communities to participate. So there was this history of people undertaking research for research's sake and the curiosity of it. If you put in an application to us sort of saying that's not necessarily going to be that well received, you'll get feedback that it has to show some benefit for the community. Aboriginal community control of research, and this is different to Aboriginal community control health organisation control of research. I don't know why, but some people do misinterpret that a bit. So long as the community who is involved, which is involved within the research, has a level of control over the research is what that criteria is about. Cultural sensitivity. So look, This is to ensure that the research being conducted is being done in a way that is as culturally sensitive as possible with the communities for which you're undertaking the research. Example of that may be if you're undertaking research that is, say, perhaps focused at Aboriginal women, making sure there are Aboriginal women who are part of the project, or that if you have a project reference group, that hopefully the majority of that group are Aboriginal women. Reimbursement of cost. So research, and I'm so sorry, this seems like they're doing a fire alarm test right now, but we can't quite hear it properly in the room I'm in, so things are not going that well. But if you can hear an alarm going off in the background, it's the fire alarm in my building. There must not be any imposition upon Aboriginal people, communities involved in the research. So often this is overlooked, and it's showing people that you appreciate their time and compensate for their time when you're conducting research is incredibly important. The other thing is that's quite often overlooked is if you're saying you're going to do this work, say in an Aboriginal community-controlled organisation, your research may not be the highest priority for that particular research. So you really have to think about what's a way to sort of appropriately compensate for time or giving kind support to that organisation for the time they're going to spend working on your research. Enhancing Aboriginal skills and knowledge. This is a big one across almost every domain in research, and that is that you're building a capacity, capability of Aboriginal participating in lead research. This is more than just saying we'll train Aboriginal people to collect data for research. This is about depending on the scale of the project, that those Aboriginal people involved will then have a different level of confidence in order to be involved in research, and may well know more, may well know more about conducting research in the future and have that sort of capacity building. For really large scale projects, it's very good to see when they've attached, say, PhD scholarships to those projects for Aboriginal researchers. And Aboriginal governance and ACHO support. Now, this is a really important thing. So I've been through the 5 criteria, but it's really important to have strong Aboriginal governance with your project, and it can be shown through a number of ways. And that's sort of establishing your governance group or establishing an Aboriginal reference group. There is a difference between those two, and depending upon what the nature of the project is, the Ethics Committee may ask you to have a governance group. Governance group has the power to stop a research project from happening. So if it's perhaps something, say, in genomics, looking at that sort of genetics, we will ask if that is a governance group that has sort of the power to be able to stop research. If it's perhaps somebody doing a PhD project, it would just be a Aboriginal reference group. ACHO support and letters of support, it's incredibly important to have these. So telling us that you've spoken to the local health service is great, but we kind of do need something in writing as well, just to confirm that that's actually happened. These are the national frameworks and guidelines. So we've got, this is the Aboriginal specific, so this is the ethical conduct in research for Aboriginal and Torres Strait Islander peoples and communities, guidelines for research and stakeholders. Now, if you have a look at this document, it'll take you about an hour to read through the entire document, and it's really worth a read if you're planning on conducting sort of Aboriginal specific or research that has a strong Aboriginal component in it. The document has these 6 key principles, with spirit and integrity being the central principle to the other 5. The other document that's really important to have a look at is the Keeping Research on Track, which is in its 2nd edition. That is intended more as a community resource for community members to be able to read and see, is the research project on track and is it doing what it's supposed to do? It's a great resource for researchers as well when they're working with our communities. And this is, of course, the national statement on which our work is based, as well as the Aboriginal specific guidelines we saw there. So this is in the process of being updated. You'll see one chapter that's highlighted there. And so that's a chapter that's related specifically to Aboriginal and Torres Strait Islander peoples. It's about a page and a half. So please, you should have a read of that if you're going to conduct research in our space as well. So this is the Governance Award, so I stole my thunder. So we won this the other couple of weeks back, which was absolutely wonderful. Great recognition for Auntie Val, Uncle Danny and the others that have been on the committee, as well as the work of people like Sandra Bailey from the Sachs Institute, had been the CEO of AH&MRC for so long. So while I'm the current chair of, myself and Summer are the current chairs of the Ethics Committee, we do so knowing that the committee has had a really long history of great people, and we wouldn't be where we are without everybody around us. So that's it for me. I can stop sharing if you like.
Thanks, Michael, and great to go through those. I'm sorry, I didn't mean to steal your thunder, but just really worthwhile acknowledging that enormous contribution of the Ethics Committee and the AH&MRC in ensuring that research is culturally appropriate and meets all of those requirements as set up. And again, highlighting kind of the links of those, of all of that work. It's been going on for a long time, but it, those building blocks have been started decades ago, and now kind of, I guess, seeing the impact of the Ethics Committee on the sort of research that's being conducted. So really important work. Thank you. There's no comments in the chat function at the moment, so I'm just going to move on to our final presentation for the day, and that I'm very pleased to also be able to introduce Professor Juanita Sherwood, who's going to be talking about Indigenous methodologies. So Professor Sherwood is a proud First Nations woman with Wiradjuri, Maori, Maori and Anglo-Celtic lineages. She's a Professor of Australian Indigenous Education at ETS and an adjunct professor at Charles Darwin University. So Juanita has been a nurse, teacher, lecturer and researcher for over 35 years and is widely credited for increasing the uptake of Indigenous-centred research and decolonisation methods in Australia. So I will pass over to you, Juanita, and to hear about the sorts of methodologies that might be appropriate when you're working in Aboriginal health research. Thanks, Juanita. So I've got your slides, and yes, we've got you as well. Thanks.
Okay, so I can just press the button and they'll go through. Yeah. Or
I think so. Give it a try, and we can see if the next one. Yep, that's all good.
Perfect. I've just got to let you know I've got a very passionate cat here who wants to participate as well. So she's very ethical. Thank you, and I'd just like to acknowledge the lands and I'm on today, and recognise and acknowledge all the previous speakers. You really laid the you laid the pathway very clearly for me to jump in the last space. So thank you, Kathy, and Michael and Karen. Great work. And I wanted to sort of okay, let's get into, okay, how do I get to the next slide? Yeah, great. I guess what I think is really important to the Indigenous research methodologies is knowing, and Indigenous research and Indigenous ethics is that we have a different way of knowing and being and doing. And we know that because we think of health in a holistic way. We do health around the health and well-being of our communities, not just an individual, which is a very different positioning than the Eurocentric agenda around health. And that is really critical to acknowledging and being aware that, you know, we acknowledge things differently from that different perspective. And that is really critical to how we proceed and how we want research to work. I wanted to just say one thing is that with research methodologies, we need to be very clear about our approaches in research, as we will be challenged by those who believe they are the experts about us and of us. Now, really critically, we still have those experts who, and I think, Karen, you talked about, you know, people doing research and Michael doing research without really walking the pathway that is really required for them to meet our needs in the community. And they really do have to, you know, they get a lot of money to do the research. They should be having more than one Aboriginal researcher on their committee, and they need to, and when they only have one Aboriginal person on their committee, they often don't hear them. So I think it's really critical that we really promote ways of knowing and being and doing that are ours, and we want to achieve outcomes from research that are meaningful for us. And really critically too, I think research data is something that we haven't talked about, but it's really critical for our communities that we don't walk away with a research paper saying that's the outcome of the research. We need to be working with our organisations and with our communities around how do we ensure that the data that we have created from our research is being utilised by communities in ways that works for them. And that doesn't mean a journal article. It may mean providing data that can help them, the communities, put data into future research programs or grants, applications, etc. So critically, Indigenous philosophy is holistic rather than the compartmentalised approach that we're taught in a health space and health education. And I think it's really important to you know, I'm a big fan of decolonisation, and we are colonised as soon as we enter an education system, in kindergarten, primary school, high school, university, and we are colonised into acknowledging only one way of knowing and being and doing. And that is, you know, we have to step back as Aboriginal researchers to remember that, you know, we come from a space where, you know, our philosophy is holistic, and that, you know, we have many ways of, you know, knowing, and its application and the ontologies are really important to the way we do research. Next slide. Yeah, I can't do that. So I know ethics has been talked about, but I just thought, you know, ethics are bound by culture, and this means that Indigenous ethics requires an Indigenous way of knowing and being and doing to ensure that we do not do any harm in the undertaking of research projects. And Michael talked about this, and I think really critically, it's about understanding that our worldviews are paradigmatic, and that's to say that they guide and determine our entire way of living as cultural beings. And our worldviews, or how one views the world, are related to how one makes sense of the world through our respective systems of knowledge, of knowing, and related to our peoples, environments, cultures and experience. And that's vital to ensuring that we do no harm in our research. Next slide, thanks. So paradigms are the aggregate of a person's or researchers' ways of knowing, being and doing. And this, understanding this perspective, this paradigm is really important for, you know, where are you going to go and what are you going to explore as an Indigenous research methodology working in a community. And so you have to be aware that, you know, what is guiding you to design a project to find knowledges and experiences, etc. So at that, you know, these frameworks, they frame our values, beliefs and worldviews that inform the way we do things. And our interpreted framework or paradigm similarly is informed through our ways of knowing, which is epistemology, our ways of being, which is ontology, and our ways of doing, which is methodological. And so I think the reason I go to the next slide, it should hit. This is important because we say, you know, our ethics or axiology is how I act as a moral person. Our epistemology is how I know the world. And ontology, what are the authentic and fundamental elements of my world, which are, I've already said, holistic and, you know, our law and our ways of knowing and being doing. And methodology, what's the best way to learn about the world? What's the best way for me to learn about a particular issue in this research space? So these are steps for, you know, incorporating what we need to do and what we need to be thinking about in the research. So it's not just the methodology, it's all of these positionings. And that's why our ways of knowing and being and doing are really important to clarify right up front in the way we do business. Next slide, please. Now, whose knowledge counts? Now, Kathy talked really very strongly about, you know, the deficit discourse that continued and does continue to explore the Indigenous subject, and they have questioned the validity of, you know, the way we do research, etc. And the way we address research in ways using particular methodologies is really important. And for a very long time, and particularly in health, we still do it, you know, we talk about particular research models that do not enable a voice to be heard, that they are quantitative, they close down the opportunities for people to share their stories. They and they're seen as the gold standard of research. We need to be really operating in a space where, I mean, quantitative research is useful, but it needs to be, you know, it also needs to be qualitative as well. We mixed methodologies are really important in the way we do research, and we need to not be overshadowed by the old approach to silencing, or the non-positive or the positivist approach that silences our voices. Our voices are vital, because not only are they vital about exploring how we do research, but they're vital in contextualising how the research outcomes are relevant, meaningful, and how they need to be dealt with. Okay, so we need to be not implicated, as Kenichi, let's say, mainstream research practices are generally, as Kathy said, are often unwittingly implicated in the reproduction of systems of class, race and gender oppression. And we see that regularly, and we can't allow methodologies to enforce that way of thinking and doing and being in our communities. Next slide, please. So my big methodology is decolonisation, and the decolonising framework's inclusive of deconstruction by taking a part of the story, revealing the underlying texts and giving voice to things that are often known by Indigenous people as a means to redress the constructs used by academics and governments. Countering these problematic constructs, which is something that's been a theme all the way through these talks, involves a deeper appreciation of how and why we were defined in this manner, and recognising how this method holds power within the mainstream community. It also requires that we view ourselves in a different light from that of passive victims. And Linda Tuwai-Smith is, you know, the goddess of decolonising research. And she recommends that instead we must recognise our worth through the recovery of our own stories of the past, and present and become activists, engaging in a counter-hegemonic struggle over research. Now, this struggle is entwined with our own recovery of well-being through our self-determining of what really is important about the past and what's important about the present. So utilising these knowledges and praxis as methodologies in research about ourselves can present a strong argument against the populist dominant paradigms of problematic constructs and deficit discourses that don't articulate changes for and don't support self-determination and liberation. We do need that self-determination, and we need liberation from these constructs that continue to divide and cause harm. Okay, next slide. So when Indigenous people become the researchers and not merely the researched, the activity of research is transformed. Questions are framed differently, priorities are ranked differently, and peoples are defined differently. People participate on different terms. And that's going back to the issues I was talking about around the ways of knowing, the ways of being, and the ways of doing things. So we know how to talk to our people. We don't go in there with a mic, we don't go in there, which I've observed many times, where people go in and ask very direct questions and cut people down and say, oh, I've heard enough of that, I'm going to give you another question. We go in there and we build relationships. We respect the people we're talking to, and we make sure that, we, as Michael has said, it's really important to develop, a reference group or a governance group to support you in how to connect with community, how to connect in that space, how to be in that space. Anyway, they're really important parts of your methodology as well. Who you connect with, who you link into, and who you make sure that you are responding to and providing information back to. Research isn't a one-way void, which unfortunately I've seen many research programs in the past believe that that's what they are. So we have to be thinking about sharing knowledge back to communities, sharing knowledge back to our reference groups, sharing knowledge back to our ethics committees. And we need to see research as not one, that ethics is separate. Ethics is part of everything we do in our research, and it's part of our methodologies, and it's got to be seen as part of the way we explore everything in this space, and how vital it is to ensuring, as Michael said, that we do no harm in this space. So our experiences of living through colonialism and imperialism provides another dimension of how we know what needs to be shifted and how we promote our ways of knowing and being and doing. Thank you. Next slide. A method that is one that we're comfortable and is talked about a lot is yarning and listening. So I'm an Aboriginal woman grounded in an Aboriginal worldview. I believe Indigenous ethical considerations are critical to safe, relevant and beneficial research for Aboriginal communities. These considerations are respect, reciprocity, balance, responsibility and listening. Like, these are the things I need to always have in my mind about how I approach this research. And Bronwyn Fredericks says, our stories are powerful learning and teaching tools. It's in the listening to someone else's story as a human being that we can give honour to the journey someone else has travelled. And that's often all what we are doing. We are going in and talking to people about their health journeys. We're going to talking to people about a whole lot of issues that they've got the unique experience in. That's the whole idea of why we're going in, to talk to people about what they know. And we are the facilitator and co-generator of those knowledge systems. We don't hold that knowledge. So I think it's really critical that we're not the expert in that knowledge. It's our communities who hold that knowledge, who are the experts in their own ways of knowing and being and doing. So as a researcher, my role is to tell a story and provide a picture that relates to the socially constructed environment as the basis for knowledge and development. And this is where we have co-generated data. And this positioning has led to my own self-discovery and expectations of the community, and elders who have informed my passage into research. Next slide, please. Okay, so yarning, really importantly, a lot of people say they are using yarning, but yarning is about relationality. And so if a lot of non-Indigenous researchers are saying, oh, I'm going to use a yarning method, well, you need to, have a quiz about, well, how are you going to do that? Have you established a relationship? Do you have, have you set up how you're connecting? And how are you listening? Listening is probably the most critical point that people don't talk about. Although Dadiri is another methodology that we do talk about deep listening, but listening to what has been shared with you is vital. It's the way that you show respect, and it's the way that you learn. And it's really critical to the data analysis. So listening to yarning and how you approach yarning requires a lot more thinking than people generally have got. Okay, I will just go in and ask people questions. No, we need more than that. So again, this requires an Indigenous way of knowing, being and doing around how we do yarning. Okay, next slide. I guess I wanted to talk about just basically that, you know, sometimes when we talk about research, we are being activists and we breach the conventional separation of researcher and subjects because we are connected to that space, you know, and we are responsible to the community, unlike many non-Indigenous researchers. When we walk into a community as a researcher, we have responsibilities on our shoulders that non-Indigenous researchers do not wear. And our responsibility is to ensure there is no harm, to ensure that what people have said they want done is undertaken. And as a member of a research team, that we constantly strengthen the voice of our community in all opportunities to talk about what's going on. So it's really critical that there's more than one Indigenous researcher, because it's a big job. It's a really, and I think this is something in relation to yarning and Indigenous research methods, etc., that we don't talk about. We don't talk about how important it is to support the Indigenous researcher in being heard, in validating the information that is coming through, and not be screened from non-Indigenous eyes that often, as Kathy and Karen has said, see in different ways and often construct in problematic ways. Next page. Thanks. The end. So basically, I wanted to say that Indigenous research methods are not separate from the whole story of Indigenous research methodologies and ethics, and everything else is all connected, and it's not just one story. That's me.
Thanks, Juanita. Another presentation. Just that point about having everything connected. Sorry, I'm just getting feedback from somewhere. Do you mind just? Yeah, but let's get okay. So just that's not a separate thing. The methodologies aren't methodologies just for the sake of being methodologies. They're really grounded in important both history and understanding of the sorts of work that you're involved in. And again, you emphasised the importance of those relationships, the building the connections. It's almost like the starting point for any sort of methodologies, and really emphasising listening as a skill, like a very particular skill, not just a sort of passive, yes, we've asked questions and we're writing down answers, but also being able to listen with that Indigenous lens on that, and how you do that. I guess that you've talked about a few different ways that you might do that. So I might just ask, we do have a short amount of time for a couple of questions, but if I could ask the speakers just to put on their cameras for now. And look, I know there's been lots of interest in the discussion so far, but no particular questions. But I did just want to ask one question, and it came across in all of the talks, was around the fact that obviously having an Aboriginal voice is fundamental, but it's actually really quite hard to do, and people are not often doing that well. They're either having a sort of a tokenistic input. They might have one person who's part of a committee, but either not hearing that person or that person isn't appropriately supported. And I just wondered if you had any suggestions. I know you've come up with a couple of ways of addressing that, but how do you in a non-tokenistic way, really support and get that Aboriginal voice to the discussion. Thanks, Karen, you've got your hand up.
Yeah, I would just like to say how that was done, and it was actually the Sachs Institute who introduced me into having a voice in research. Before that, I was quite intimidated, didn't feel that I could have a voice, or you know, and I think Kathleen, listening and seeing your slide today reminded me of how much, because you spoke so amazing, and your presentation, I was reminded again, this isn't my forum, this academia. So I think when Michael mentioned about how you build the capacity, getting Aboriginal people to understand that their knowledge and what they have to say is valuable and recognised, and how that is supported. And the Sachs Institute had other Aboriginal workers who helped talk to us, you know, and in that story and yarning and sharing that, you know, you can do this, how we can capture this without this formalised, you know, we meet in this session and this is how we do and this is our format, to allow the conversation to flow and those stories. You know, I think it is, if someone hasn't really had a yarn, you know, it's not just getting in a round circle, sitting and answering these questions. It's really sharing those life experiences. So I can't thank the Sachs Institute for introducing me and showing me that anyone can have that voice.
Great, thanks, Karen. Does anybody else want to comment on how you build in those Aboriginal voices into Aboriginal health research?
Thanks, Sean. Yeah, look, can one of the things that tends to happen is asking Aboriginal people who work for you to be your Aboriginal reference group and employees of the organisation, and that's not a good way to do it. You need somebody who's independent, and in the structures of universities as well. If you've got, like, I don't know, Professor Chapman on the project, you know, professor, well, that person's empowered. But you see research assistant, somebody who's on a project, you kind of like, there is a real power imbalance within the structure of how things are done. So ensuring there's senior Aboriginal people involved, or that the Aboriginal people involved are not in a sort of a subordinate position whereby they might want to, you know, give responses to answers that maybe their boss is really wanting to hear. So there are ways of doing that. I think people get better as they go on with this a lot of the time, is what I'm really pleased to say. So sometimes we get applications to the ethics committee and they take a long time. Quite often those same researchers will come back a year later and it'll be much better, and they kind of learn, think about how they can do these things better. So it's an evolving space.
Yeah, great. That's good. That's I guess that capacity building, both for Aboriginal people and communities, but also for non-Aboriginal researchers working in that space, is something that happens over time and with support. So
I think, Sean, too, by asking, what we often do is introduce, you know, researchers to other sections of our community. So in going out and connecting to people they mightn't have considered, and also how they can help build that capacity. And organisations often, unless you have an introduction, it can be hard to get into those organisations or community groups.
yeah, absolutely. And I think, Kathy, you had your hand up there as well.
I was just going to add, just flexibility in your approach is really important. I think being willing to modify your plan, and I think, you know, for the health department people who are listening too, you know, it's difficult to be locked into a research plan. Often with funded research, you put together a proposal, but you have to be able to modify that. You have to be able to amend and adapt and respond and include the voices in that way and be willing to take change on board. I think that's sort of, and the other thing I think is employ researchers, Aboriginal research assistants. I'm amazed across the university, we're wondering why we don't have an Aboriginal academic workforce. Employ people. If there's an opportunity for a research, doesn't have to even be an Aboriginal research project. If it's a research project, put them on board and assist people in that way. It's
Yep, great, thanks. It seems very obvious, doesn't it, when you say it, that it doesn't always happen quite like that. Carmel has a question in the chat, which is about adopting strengths-based reporting approach. Thoughts on how best to manage community fragmentation as a barrier to engaging in community. So I guess the question is around managing community fragmentation. I don't know if anybody would like to speak to that one particularly.
It sounds like it may have a little more context behind it. Not sure if whether the question is coming from a particular experience, but there are some assumptions there about you as a researcher having to manage community fragmentation that I think maybe needs a little bit unpacking. I mean, reality is communities are not all cohesive. Any community is not just a cohesive thing that everybody's in agreement. Australian communities and ethnic communities certainly aren't, and Aboriginal communities aren't either. This is about managing reality and when you're in your research. So I'm not sure if there might be.
Yeah, thanks, Kathy. Karen, you've got your hand up there as well.
Yeah, so we definitely we have that within our community, and depending on where the research is placed, do you need to talk to all those, components of the community? So definitely, if you are finding that and you are needing to talk, then you talk to everyone. You do not exclude because this person's or this organisation or that are on different, communications. But definitely this is what we've seen within our community, that the way governments have set up funding has created some of that fragmentation within our communities. And we were able to, because grown up, lived there all my life, we do have a seat at the table. We've had a shared agenda where we're able to come. So if someone is wanting to do research, they know that they can come to our organisation because we do have all of those community partners at the table and we can talk. So it's definitely, you may have a person in the community who is able to go into those different sections, but it's okay. I think just being transparent with with all the agencies or stakeholders who you're talking to, that you are talking to different sections of the community and getting different points of view, just being upfront.
Yes, good suggestion. Thanks, Karen. And I know we're kind of close to the end of time, but we do have one question from Angela here about advocacy with decision makers and funders. To use a strengths-based approach is important. Any advice on how we do this? Is that something anybody would like to provide advice on, using a strengths-based approach around advocacy with decision makers and funders?
Advocacy. Oh, you go, Juanita.
Pastor Juanita. Juanita, you're on mute, so you were.
I haven't got an answer. I'm leaving. I'm sorry. I've got another meeting to get to.
Okay, thanks, Juanita. So, Michael, did you want to take that question?
I think it's kind of set up in an underlying narrative of a deficits from the very second something's put out to tender. So it's a bit difficult to directly do that, but what you can do is aim that any research project that you get up as a result of getting that tender takes more of a strengths-based approach, and that you try to be positive in what you report and balanced. It would be the main thing, and to use your networks to subtly influence a change so that such sort of things don't happen if you're talking about a tender sort of process when research is being called for.
Right. Thanks, Michael. And I think that might be the final word, just because we're right out of time. But I would really like to say a sincere thank you to all of our speakers today. It really has been a very interesting and useful session. So thanks to Kathy Clapham, Karen Beats and Michael Doyle and Juanita Sherwood. And yeah, really appreciate your time and sharing of your expertise and experience in this space. And just to sort of quickly finish, unrelated to this, but just to note that our Research Action Awards are open for the year. So this is for our member organisations. So if you are part of one of our member organisations and your research has had an impact on health services or health policy, you can apply, and there is a prize of $5,000, so it is worthwhile both having that public recognition of it, but also the financial reward as well. So that is available online. We've got that available now up on our website, and we'll have an awards ceremony in November to recognise those winners. So that's the end of the session today. So thanks so much for everybody's time, both the presenters again, but also all the participants. Really appreciate everybody's input. If anybody has any additional questions, comments, thoughts for how the SACS forum might be useful for you, you can contact myself or Amanda Dominello, whose details are there. And enjoy the rest of your afternoon.